mental health conditions. Depression, anxiety, and post-traumatic stress are the main ones. And they are very frequently misdiagnosed or missed altogether in a primary care medical office because they can manifest themselves physically in people. You can have the condition of depression, but you might not feel particularly depressed, even though you've got many of the characteristics that qualify you as having that diagnosis. And it can be that the main manifestation is something in your body, whether it's a migraine or fibromyalgia or irritable bowel or trouble, pain in your chest, difficulty breathing. Low back pain is a very, very common one. Pain in the pelvis, bladder spasms, numbness and tingling in the extremities. Huge long list of symptoms from head to toe.
What are and if you can, what are some of the questions on the diagnosis list that's you found particularly predictive or informative?
Yeah, we've covered a number of those already. Are the symptoms moving around? Are they variable? And the very last question is quite telling for a lot of people, which is, if you learned that a child you care about was growing up exactly as you did, would you feel sad or angry? Many people who look back at their own childhoods, they don't necessarily recognize the reality of what they went through. None of us has a parallel life to compare ourselves with. So when we look back, we don't necessarily realize just how difficult it was for us. And I've had a lot of patients who say, no, my childhood was fine. My parents cared about me. Really, things were okay. But then I ask them, okay, well, imagine your own kid growing up in that same environment. And let's imagine that you're a butterfly on the wall of your childhood home and you're having to watch your kid try to cope with what's going on there. Would you be okay with that? Or would there be some things going on that would make you sad or angry, or some things that you wouldn't do yourself to your own kid? And very often in my patients, I will see their facial expressions change dramatically as they start to think about this. And that gets us into a discussion that things were maybe not quite so good as they used to think. And we can work with that. We can help people understand how much they went through. We can help them feel good about themselves for having overcome it. It's really important that if your childhood environment needed heroic perseverance to get through, that you give yourself some credit for that.
What jumps out at me is it sounds like people, again, blame themselves in part or in whole for even the most horrific situations. Maybe that's why they react so strongly to that question. Like for them,
Yes.
They're like, well, there's probably some part of them that thinks that, but someone else, like their kid, hell no, I'll rip their head off.
Yes, absolutely right. So many kids, they don't have that many options for how to cope with what's going on. And so very often what they do is they try to be the best little kids they can be. They try to fix the situation, whatever it is. A classic example is, let's say you have a parent who's an alcoholic. One of my patients at the age of 8 was trying to hide her dad's liquor bottle so he wouldn't drink so much. It's not appropriate for an 8-year-old to be their dad's alcohol counselor.
Yeah.
And you're going to fail at that as an 8-year-old. And when you fail as an 8-year-old, you feel like a second-rate or worthless human being. And that becomes absorbed into assumptions about who you are as a person that can stay with you for decades. And it's part of the treatment to help people realize, how that false assumption got in there, who taught you to believe this about yourself, and how did they teach you this false belief? And when people see that, they can begin to flip the script. They can start to think, you know what? I actually did a pretty darn good job coping with that environment. And I actually should feel very good about myself as a kid for how much I had to deal with.